Happy Tuesday, guys. This is Dr. Michael Tancini here at Grand Overhead PT. And I hope you had a great start to the week yesterday. And today's Tuesday. It's the next day of the week. And it's another day to where you can really do whatever it is that you really love to do in your life. And you get to get back to work. You get to start your day with a bunch of movement and mobility and improve your mindset so that you can really set yourself up for a great day on this Tuesday. So, guys, today's mindset piece, okay, let's jump right in. The past is over. Learn from it. The future is coming. Prepare for it. The present is here. I'll live it. Right? Guys, it's this idea of anything that has happened in the past, we can't control it now and we can't change it. Anything that's in the future hasn't even happened yet. So we can't sit here and be anxious and worry about things that might not even happen. It isn't a very good use of our time and efforts and our energies, right? But the one thing that you guys all have control over is right now. So what are you doing right now? What are you doing? And now could be in context of this moment, this day, this week, this month, right? So what are you doing right now, which you can control to make your life the best that it can possibly be? Now, guys, I know a lot of bad things may have happened to you in the past. Or on the flip side, I know you may have had a lot of great things happen to you in the past. But living off the past isn't going to get you anywhere in the future. And living in the future to all these future events that might not even happen isn't a good place to be. Simply because they haven't happened yet and they might not happen. And if you focus on that, you're missing out on the opportunity to focus on the now, which is going to make that future come true if you focus on the now. Okay, guys? So if you want to be in great health and great performance and feel great in the future, well, then, guys, focus on what you can do now, which is leading us to the mobility portion of getting your body moving better, feeling better, so that you can feel better for the future before you. Okay? So, 3 things we're going to do. All right? First one is you're going to sit cross-legged. Okay? You're going to see, I can't get my leg up on my knee here. All right? I just can't do it. I'm not that mobile. Okay? So what you're going to do is you're going to hold that leg down with some kind of object. Okay? And you're going to cross over. Okay? This can be a kettlebell or a kettlebell. This can be a med ball. This can be a bumper plate, whatever you guys may have. Now, if you can get your foot up on top of the other knee, well, then, guys, get that foot up on the knee and use the foot to drive that knee down. But me, I'm not that mobile, okay, but some of you guys are. So pin that knee down, and I want you just to lean over. All right, try and open up through the hip, open up through the side. Okay, I want you guys to spend 2 minutes there. Okay, 2 minutes there per side. Okay, so on the other side, prop that baby down. Okay, using some kind of object, heavier object, to really pin that knee down. Okay, so that you guys can get a super nice stretch through the through the lateral midline, and really free up that trunk, free up that hip. Okay, guys? So that's number one. Number two is going to be your classic twist of the spine. So it's classic spinal twist. Okay. So you're going to lay down on your back. Okay. You're going to have both legs out straight. You're going to keep the opposite shoulder on the ground. And you're just going to pull that leg across. Keep the opposite leg on the ground, pull that leg across. Okay, guys. Now, I don't want you just to extend through the back here. Okay. Squeeze the abs tight. Bring the leg up and over. And really drive that knee down to the ground. Pulling it with the arms, but keeping this other shoulder on the ground. Okay. Working on the hip here. Work on the spine. Guys, I want you to breathe through this for 2 minutes each side. Okay. Breathe through this for 2 minutes each side. This should feel super, super good, especially on the back of the hip and up through the spine. Okay. So, guys, that's number two of the last one. Okay. You're going to get a ball. You're going to lay down on your back. You're going to put that ball right on the stomach. Okay. You're going to get a kettlebell. And you're going to pin that ball to the stomach. All right. So you're using the kettlebell weight to smash out the stomach with that ball. You know, guys, I don't want you down on your pelvis. I don't want you up on the ribs. I want you lateral to the midline of the body. So on either side of the six-pack abs. Okay. Work it down close to that pelvis, but not on it. Okay. And then we're just going to floss the leg up and down. All right. You can do it with a bent leg. You can do it with a straight leg. Okay. Really just trying to work on all the anterior structures here. Working on this front fascial line. Okay. Free up the hip, free up the torso. Just to get that spine and that hip moving better. Okay. This is going to make your back feel better. This is going to make your hip feel better. It's also a great way if you just let the ball sit here, stay in the kettlebell, and just breathe in and out. Focus on trying to breathe into that ball and into that kettlebell. Great way to work on breathing mechanics. Also, freeing up the back a little bit, freeing up the spine, getting you feeling better, and helping you calm down and decrease tension through the body after a long day in the office or a pretty long workout. So, guys, that's your Tuesday. Get out there and crush it. Okay. Get out there and crush it. There's your 3, 10, 15 minutes, 2 minutes on each of those per side. Okay. And that will leave you feeling great for the day. And tomorrow we'll be back at it. Another mindset, another way to get your body moving. Okay. So you can continue to thrive in this pandemic we all know is COVID-19. So, guys, this is Tancini. I'll see you next time.